want to say good morning to all of you and welcome you to AM Joy. And there is no mincing words this morning, as we've just discussed. We are in the midst of a global pandemic that shows no signs of slowing down. Worldwide, there have been a total of 147,000 confirmed cases and more than 5,000 deaths, according to Johns Hopkins Center for Systems Science and Engineering. And here in the U.S., there are now more than 2,200 known cases and 50 deaths, according to NBC News numbers. Though that number is likely to grow significantly because we are simply not testing at the rate that other developed countries are. And the cases of community transmission, meaning transmission between people here, not people traveling here, those will continue to climb. It's also important to understand that while it has symptoms similar to the flu, and people are consistently comparing it to the flu, the novel coronavirus, or COVID-19, is more contagious and more likely to be fatal than the seasonal flu, according to the experts. And we have to face forthrightly that the health threat and the mass disruption that we're all facing is likely to continue for the foreseeable future. And the fact that this country is far behind the rest of the world in reckoning with that, in doing something about it, is because of the decisions and, frankly, the ineptitude of the Trump administration. It did not have to be this way. It should not be so difficult in a developed country like the United States to obtain a coronavirus test that yields valid results. Other countries have managed to do it. So what happened? According to Politico, by the end of February, the World Health Organization had shipped test kits to nearly 60 countries. The U.S. was not one of them. Instead, the Trump administration shunned those test kits and instead ordered the CDC to manufacture their own, America First. But lo and behold, according to ProPublica, those tests proved to be faulty in, quote, almost every way imaginable. And so now we're scrambling. The lack of available testing led revered immunologist Dr. Anthony Fauci to say this on Thursday.
The system is not really geared to what we need right now, what you are asking for. That is a failing.
And failing, yes.
It is a failing. I mean, let's admit it. The idea of anybody getting it easily, the way people in other countries are doing it, we're not set up for that. Do I think we should be? Yes, but we're not.
And availability of the test, people getting the test, is not the only factor contributing to what can only be called mismanagement, the total mismanagement of the coronavirus crisis here. There are also questions about whether the requirements for testing are too strict. As the New York Times wrote on Thursday of people seeking tests, quote, some have been rejected because they had no symptoms, even though they had been in proximity to someone who tested positive. Others were told no because they had not traveled to a hotspot abroad, even though they had fevers and hacking coughs and lived in cities with growing outbreaks. Still others were told a bitter truth: there simply were not enough tests to go around. And there's the even more disturbing reporting that the lack of testing is due in part to the President of the United States' obsession with keeping the numbers of U.S. cases low. And this isn't just speculation. Here's Trump saying it when a ship containing sick American passengers was forced to dock off the coast of California last week because the president didn't want those people to come to shore.
They would like to have the people come off. I'd rather have the people stay, but I'd go with them. I told them to make the final decision. I don't need to have the numbers double because of one ship. That wasn't our fault.
I don't need to have the numbers double. And Politico reports that experts inside the Trump administration who know that we need more testing have been reluctant to tell the president. Quote, as the outbreak has grown, Trump has become attached to the daily count of coronavirus cases and how the United States compares to other nations, reiterating that he wants U.S. numbers kept as low as possible. Health officials have found explicit ways to oblige him by highlighting the most optimistic outcomes in briefings, and their agencies have tamped down on promised transparency. And this, it's a clearly difficult situation when the top wants to hear certain answers, says one former official who's briefed the White House. That can make it difficult for folks to express their true assessment, even the most experienced and independent minds. What's equally confounding is that some people have been able to get tested. People like NBA stars and at least one member of Congress. Congresswoman Alexandria Ocasio-Cortez summed up what a lot of people have been thinking during a recent appearance on Fox News. And yes, I did say Fox News. It is just that kind of time.
It almost seems like the more wealthy and powerful you are, the more able you are to access a test. But the more, the rougher a road you've got here, it's going to be a lot more difficult for you to access health care. That's exactly the recipe for disaster.
Donald Trump declared a national emergency on Friday, and he said his administration was working with the private sector to make testing more widely available. But even that announcement was marred by confusion and false statements. There is some potential good news this morning in the form of a bill passed late last night by the House. The Families First Coronavirus Response Act, negotiated by Speaker Pelosi and House Democrats, with Steve Mnuchin representing the administration. It could make more tests available for free, and the president does say that he will sign the bill. But first, it would have to pass the Senate, which Mitch McConnell dismissed this weekend, instead of keeping senators in Washington to get this urgent, extremely urgent work done. And joining me now to discuss that legislation and where we go from here is Senate Democratic Whip Dick Durbin of Illinois. Senator Durbin, thank you so much for being here this morning.
Glad to be with you.
Let's first talk about the testing piece of it, because I think what is shocking, I mean, I live in New York City part of the time, and this is, the most modern, best city in the world, right? Modern city. It is almost impossible to get a test here. Can a member of Congress get a test? Can you get a test if you want one?
I don't know because I haven't asked, but I'll tell you the state of Illinois is not much different than New York. We have about 13 million people in this state. We are testing about 300 to 350 a day. That is totally inadequate. The testing to this point has been a disappointment and unfortunately has made the situation worse.
And okay, so the testing is a problem. That's part of it. One of the challenges is that we could have had a test. The World Health Organization approved a test that's made in Germany by a company that is used by almost every medical lab in the country, I'm told, is very familiar with this company. They made a test. Donald Trump, the administration, rejected that test, wanted one made our own. Could the United States Congress, could the Senate and the House pass a bill saying we just want to buy that test? We just want the United States to have the WHO test.
I'm not sure at this point. I would certainly support any effort to put together a credible medical test that can be used in volume in the United States to really survey the number of people who are infected, to find out if there are clusters of those people, and to make sure we do everything we can to mitigate any spread. But I will tell you, at this point, we have lost 3 to 4 weeks of testing. Is that important? Well, think of this for a moment. The first case of coronavirus was diagnosed in Italy on January 31st. 5 months later, they had closed down 25% of the Italian economy. 6 weeks after that first case, they closed down the entire Italian economy. So 6 weeks from the first diagnosis to the decision to basically quarantine a nation. So 3 weeks lost on the front end of this does not make it any easier for us to contain it in the United States.
And let's talk about the bill that was passed in the House late last night, overnight. Is that bill going to come to the Senate floor when Mitch McConnell decides to end the long weekend that he's given the United States Senate?
Well, I certainly hope it comes immediately. And Senator McConnell has it within his own power to convene the Senate and to ask for unanimous consent that that measure pass even before all of the senators return and all the staff return to the Capitol building. This is an extraordinary time. Yesterday, we closed down the schools of the state of Illinois. We closed down the court system in Cook County and Chicago. It's an exceptional time, and I wish Senator McConnell would get into the spirit of this effort, this national bipartisan effort to deal with it. If he said, I'm going to ask for unanimous consent so that all the senators and all the staff people don't have to return to this Capitol building, it would mean we'd get moving more quickly. Hats off to Nancy Pelosi. What the Democrats said was the highest priorities are testing and the families who are going to need the test. And this bill, not the last bill by any means, but this bill critically moves us in the direction of guaranteeing free, or at least affordable testing through every mechanism in the United States, and a paid family leave and medical leave for the employees who are sick and should stay home.
Yeah, and I think a lot of people were alarmed to watch the Fed pump $1 trillion instantly, almost instantaneously into the banks, into the financial system. Can Democratic senators guarantee that no bill will be allowed to get on the floor or pass in the United States Senate that gives any money that could trickle back down to Donald Trump's hotel industries, that could pay off the banking industry or the shale oil industry, which he for some reason thinks ought to get paid? Will Democrats ensure that those industries, that those super rich do not get paid off of any bill that passes to help ordinary people?
I could not speak for or guarantee what Senator McConnell and his Republican Senate caucus is in favor of or opposes at this point. But I do trust Speaker Pelosi and the House Democrats to make sure that this doesn't turn out to be some sort of windfall for certain industries that are the favorites of the White House. Let's make no mistake about it, though. This is going to take its toll on the economy. When Delta Airlines announced yesterday that they were going to reduce their flights by 40%, that means idling a lot of planes, a lot of pilots, and a lot of workers at every level. And that's going to happen in a number of industries that are affected by this pandemic in the United States. I want to make sure we get this economy back on its feet in a sensible way. We shouldn't play favorites in doing it. Let's have first families, take care of families and workers, the first victims of pandemic if we don't do this right. And secondly, to get the businesses back in a position where they have a future as well. Small businesses first.
Yeah. Senator Dick Durbin, thank you very much. Really appreciate your time this morning. Thank you.
Thanks, Jerry.
Thank you. And joining us now is Dr. Ashish Jha, the director of the Harvard Global Health Institute. Sir, Dr. Jha, thank you so much for being here. Let's start I'm going to go back to where I started from, back to the beginning. On testing, can you explain, why it is so important that we be testing broad numbers of people?
Yeah. Good morning, Joy. Thanks for having me on. Absolutely. Look, if you want to know who's got the infection, because obviously if you have the infection, you can spread it to others, you've got to be able to test. And the strategy that almost every other major country is now using is you test people, you identify them. If they're infected, you separate them, and then you track everybody that they have been in contact with, and you monitor them for symptoms. If they develop symptoms, you test them. And this is how we bring epidemics under control. This has been the standard strategy for 100 years. It works. The linchpin of that is the ability to test people. If you can't test them, you can't take on this strategy, and you can't know who's sick and who's not. So it's incredibly frustrating that we can't test the kind of patients that we need to be testing right now.
Let me play you a soundbite that I heard this morning, and this was Governor Larry Hogan of Maryland, which kind of alarmed me. I want to let you respond to it. Here he is, Governor Hogan.
The real concern for us right now really isn't about testing. It's about stopping the spread, social distancing measures, preparing for the kinds of things we can do to stop and slow down the growth. And quite frankly, at some point, we're not going to be arguing about the testing. We're going to be worried about taking care of sick people.
This seems to me a leap way ahead. I am a layman. I am not obviously a professional like yourself. But we are testing in the United States 23 people per million. And to compare, South Korea is testing 3,692 people per million. How can a governor of a state that's got cases, like so many states do, say that testing is not a priority?
Yeah, so it's a really important point. Look, our estimates are that we should be doing 150,000 tests a day in the United States. We're not even doing a tenth of that right now. But that's probably the kind of numbers we need to be doing if we're really going to wrap our arms around this. What the governor is saying, and I would disagree a little bit about the testing issue, but he does have one very important point. If you can't test, which is where we are right now, that we can't test widely, then you've got to implement these very difficult social distancing stuff. So we've got to close every public school. Every school in America has got to close down right now. That's where we are. Businesses need to be letting people work from home if they can. We should have no public events, no concerts. Nobody should be going to museums. That is a strategy that you need to implement when you don't know how bad the infection is in the community and when you don't know because we can't test people. So I agree with social distancing as a critical strategy right now. But that doesn't doesn't, to me, diminish the need for testing.
Yeah, and so this is the other thing I think that bothers a lot of people. They don't understand some people can get tests. So we know that a Utah Jazz player has it because obviously somebody or people in the Utah Jazz players are getting tested. South Korea has managed to test lots of people. They've just, they're prioritizing the most vulnerable people. The CDC has only tested 77 people this week. And yet the Utah Jazz was able to test all 58 players in a matter of hours. This was a gentleman named Sawyer Hackett tweeted that. How are some people getting access to this?
Yeah. Look, the testing strategy right now is because the tests are not materializing from the federal government. We were promised by Vice President Pence a week and a half or 2 weeks ago that we'd have 1 million tests by the end of the week. That obviously didn't happen. Every state is taking its own approach, and states are essentially rationing tests. And every state, and I actually think I have a lot of sympathy for state officials. State officials are doing a fabulous job under very difficult circumstances, Democratic and Republican state officials. How any one individual group got access to the test, I don't know. What I know is that it was probably that state that made the decision to allow that group to be tested. But the bottom line here is we have put state officials behind the 8 ball. They're having to ration tests, and they're making difficult decisions, and that means preventing doctors who need the test for some critically ill patients from being able to test those patients.
Right.
It's a very tough situation.
And it's important to have known that Utah Jazz player was positive. That's, I think that's important to know. But there are also probably elderly people in Utah. There are probably people immunocompromised in Utah that could have used it too. But if the rationing means Utah Jazz players can get it, rich people can get it, but regular people can't, that is a weird kind of rationing. That's me. I'm not going to put that on you. We have another story that I just want to present to you. In the Seattle area, nursing home. A nursing home was unable to test 65 workers. Here's a great contrast with that previous story with COVID-19 symptoms. They have symptoms. They can't be tested. I was talking last night with a doctor. I was filling in at the 10 o'clock who has 5 patients that were symptomatic who can't be tested. They can't be approved for it. How can it be that healthcare workers are not a part of this forced rationing of tests?
Yeah, look, when we have such limited testing capability, and again, it's worth understanding for your listeners that almost every major country in the world is doing many, many more tests than we are. When you have forced rationing, you're going to make some decisions, and sometimes those decisions are not going to be good ones. And obviously, we need to be testing healthcare workers who have symptoms. We need to be testing vulnerable patients, older patients, immunocompromised patients who have symptoms. Those are the people who should be the top priority. I have a lot of sympathy, again, for state officials, for doctors, for other people who are working under extremely difficult circumstances when they can probably get tests to 1 out of every 10 or 20 people who need it.
And very quickly before I let you go, is mobile testing a good idea? Because that's a thing that's happening.
Yeah, look, I think drive-by testing is a great idea, and if you can, again, you gotta. Well, we don't need everybody in America to get in their car and go to the mobile testing. Like, that's not a good idea. But what we need is a strategy that says, look, if you've got symptoms, if you've been exposed, any of those things, then you should be able to. And the nice part about mobile testing is then you can drive up, you get your test, you go home, and then you pretty quickly find out whether you're positive or negative or not. That's a great strategy. And drive-through testing is like the ultimate American approach. I'm excited to see it come to be. But we got to get the test first.
Indeed. Dr. Ashish Jha, thank you so much for your time. Really appreciate you this morning. Thank you.
Joy, thank you for having me.
Cheers. And joining me now is New York City Mayor Bill de Blasio, who's here. And I feel like we're not sitting far enough apart, even though it is great to see you.
We'll make it work.
Yeah, we're going to try to make it work. So the testing thing, I think, is really, and maybe I'm a bit obsessed with it, because at this point, it seems insane in a modern country, in a great city like New York City, that it seems almost impossible for people to get a test. Can a New Yorker or someone in this city that is symptomatic in some way get a test if they need it, and if so, how?
Joy, there are people can get a test. It is according to a priority structure, and it's not enough testing. It's just as simple as that. We have been pleading with the federal government for weeks, publicly, letters, phone calls, get us testing so we can get ahead of this. Here's the reality. This is a war-like situation. We're in a wartime scenario with a Mar-a-Lago attitude being used by the federal government, right? It's so laid back, and I don't understand it. And by the way, testing, how about ventilators? Where is the federal government making sure that our hospitals have the ventilators we're going to need? Where is the federal government when it comes to surgical masks, getting them distributed where they need? This is a case for a nationalization, literally a nationalization of crucial factories and industries that could produce the medical supplies to prepare this country for what we need. A hand sanitizer. People are going crazy. I don't blame them trying to get hand sanitizer.
Is it true that we're having hand sanitizer now made in New York? Or
the state has found a way to make it, and that's great. But the point I'm saying is the federal government should recognize this is literally a crucial part of stopping this.
Yeah.
There should be a national approach to ensuring every factory that can make hand sanitizer should be on a 24/7 shifts, and the distribution should go to the places that need it most. But we're not even in the discussion now because we can't even get the testing on top.
Exactly. And people are
backwards.
They're being left to their own devices to run out and stock up on toilet paper, which is irrelevant to trying to prevent the outbreak. I want to play Joseph Fair. He was on last night with me. Brilliant guy. He's a virologist who has dealt with Ebola and lots of other crises on the African continent and elsewhere. And this is the question I've been obsessing about. I asked it to him. Let me let you listen to his answer. Can't we just get the WHO test? Couldn't the U.S. or, maybe a few billionaires just buy the WHO test?
Absolutely. I mean, it would be engaging the company that makes the gold standard test, which in this case is QIAGEN, based out of Germany, but also has very large offices here in the United States.
Yeah.
If we had engaged them very early on, paid them to up-ramp their production, they're already at a lot of production, but if we had paid them to do more.
Now, I know that the city of New York is using a test, and it's a test that tests for lots of different things, right? It's a test that's sort of a one-off that you can test for lots of things,
Two things going on. Doctors in general have a test called BioFire, which you can go to a doctor's office and get. And that's to rule out a whole host of more typical diseases. Once you know you have one of those, I think it's 26 diseases, then you don't have coronavirus. That's great. That can happen right now. But once you are found to be negative for those others, then proceed to the coronavirus test.
And so does New York have the QIAGEN test?
We don't have that one to the best of my knowledge. Look, we have some testing capacity, but nowhere near what we need. Right now, if the federal government would simply, the FDA could approve automated testing by every private laboratory with the testing we have right now, it would speed up the process immensely. It would allow us to do thousands of tests a day, get results the same day in many cases. Right now, they could be doing that. On top of that, we should be going for all the additional tests from overseas.
I mean, this is a rich city. Couldn't New York just simply buy the QIAGEN test? I mean, this is the test. It is the gold standard. It's being used all over the continent of Africa. It's being used in Asia. It's being used in Europe. Every other country is using it. It's a rapid test. Joseph Fair walked me through this whole thing. It's quick. It tests directly for this virus, for the COVID-19. It's accurate. It's being used everywhere. Why doesn't New York just buy it?
If it's legal according to federal law and we can do it, we'll do it. I mean, I'll do anything at this point because, as you said about the million tests we were supposed to get, it's impossible to believe the federal government at this point. I mean, I'm saying this with sorrow, Joy. We've been calling and begging for help. I can't imagine any other moment in American history where we are in the middle of a pandemic and cities and states were pleading with the federal government to send help. And there's not even that wartime footing. There's not even the beginning of an urgency and a strategic focus from Washington. It's almost like you're used to the fact they'll let you down at this point. So we are going to take matters into our own hands any way we can.
Let's talk about schools. New York City is unique among a lot of cities and a lot of states around the country that are not closing. Why not close the schools? The argument to close them is that it would protect those young people, the kids and the teachers and the maintenance workers and everyone from community transmission. And that there are ways that you could set up feeding, making sure people get food, making sure kids get lunch. Why keep the schools open in New York
First,
City?
I don't believe we're unique. I think a lot of cities and states are grappling with this right now because here's the problem. First of all, we are worried about a cascading effect where if we close schools, watch out what happens with mass transit, how do you keep your hospital system and your healthcare going? These all interrelate. You're not going to have a functioning healthcare system if the folks in the medical field, the doctors, the nurses, the techs, everyone has to stay home with their kids. You're not going to have a functioning medical system if no one can get to work. So we have these three pillars: schools, mass transit, and healthcare system. We're trying to hold a line with that. It does not rule out at some point we feel we have to close schools, but right now we think that has to be held together. The other part of the equation, Joy, What are these kids going to do? I guarantee you, if we close, we're closing for a long, long time. Do we really believe these children are going to stay holed up in their room for a month, 2 months, 3 months? No. They're going to go out into their neighborhoods. They're going to gather together in groups. What are families going to do? They're going to go see their neighbors. They're going to go see their friends. And we've recreated those social networks and the spread again. In a school, a child is supervised and safe. Here's a number that should be sobering. There's over 400,000 teenagers in New York City's public schools. Do you want 400,000 teenagers home without adult supervision? Think about all those dominoes that might fall in that case. So we have to strike a balance right now.
Yeah, we just getting this news in my ear right now. My executive producer just got in my ear. We just got reports that the first New York City resident has died. An 82-year-old woman has died in New York City of COVID-19.
We've been very, very worried about her. She had, to the best of my memory, pre-existing conditions, obviously advanced age. I was hearing the same news just before coming on. We wanted to confirm it. Joy, it's tragic. We're going to lose some people here, and there were some, I am certain, that could have been saved if the testing were here from the beginning.
But here's the thing. New York City is also the most accessible city in the world in terms of mass transit. You can actually get all the way from way deep in Brooklyn all the way to way out in Queens and in between.
Yep.
Can that transit system stay open? This woman, we don't know who she's traveled near. Right. We don't know if her family members get to visit her by train, by bus. We have a problem here, and that community transmission would seem to be quite easy in New York.
Yeah, but let's demystify for a moment. The World Health Organization just came out with yet another report. 65,000 cases in China that they tested.
Sure.
They studied, I should say. And this is not an airborne disease. So you can be on the subway with someone. That's not the problem. The problem is the close contact, the transmission of fluids between people. That's what we know. Now, what we've got to be clear about is right now our subway system, I agree with you, it's extraordinary, but it has emptied out in large measure because of just plain reality. People are telecommuting.
Yep.
We've asked people, and we're doing it ourselves as a city, to stagger work hours off of rush hour. So there's a lot fewer people on the subway. There's more distance. That's good. But you take out the subways, you just collapsed your healthcare system in many ways. That's the blunt truth. And the thing we have to be honest about in this country is if we don't keep the healthcare system together, that's when this becomes overwhelming. Those professionals, they have to be at work. They can't be home with their kids. They have to be able to get to work. We have to keep them healthy. So when the governor of Maryland spoke earlier, he was talking about that danger up ahead, where our last line of defense is our healthcare system. But we have to be honest about all the things that we need to keep it intact in the meantime.
Yeah. What about, I mean, and I have a friend who was texting last night. We were doing this sort of Q&A and couldn't get his question in, but I think it is a good one. People who are immunocompromised
Yes.
now, people who are living with HIV, who are living with immunocompromising illnesses of all kinds, what should they be doing right now if they're in
high
New York?
level of isolation. So if you've got just 5 areas: immunocompromised, cancer, diabetes, serious heart disease, serious lung disease. For folks who have one or more of those conditions and are over 50, that's overwhelmingly where we're losing people all over the world, that category. Don't go near anyone sick. Don't put yourself in a situation where you have to be too close. You don't go on a crowded subway car. You don't go to a party where people are going to be close together. You have to be very, very cautious. Bluntly, a grandparent who wants to see their grandchild, not if that grandchild has the sniffles.
Yeah.
Right?
Yeah,
it's real strict rules.
And we know now, just for the audience, the woman who died was 82 years old. Apparently, she had emphysema, advanced emphysema. She went into the hospital March 3rd. So just to give you some more information, because it is people that already have existing issues that are the most compromised. What about people who, you know, I'm just going to cite another person that I know that has a loved one who is right now in a care facility for an unrelated illness. It's not an immunocompromised sort of illness, but is in an illness, but they are now not allowed to visit. So, because I think there are also issues of loneliness, of people being isolated, of either elderly people or people who are ill, people who are in hospital care, who now can't get visitors. What do we do about this?
Right, this is a big issue. You know, some of our top healthcare professionals have pointed this out. The mental health issues here are huge. The fact that if you have a senior who is so isolated, it literally has taken away some of their will to live. It's giving them no opportunity for social interaction. That's dangerous too. So I think it's about some balance. The folks who are immunocompromised or have those other conditions, very strict rules. If you've got a senior who's healthy, It doesn't mean they can't have social contact.
Right.
It means be careful for being around anyone who might be sick in any way.
Absolutely. And we have a hard out, so I have to go. Mayor Bill de Blasio, I don't want the commercial to just cut you off. Thank you so much, sir. Really appreciate you being here, Mr. Mayor. And next up, Trump autographs a picture of the stock market as millions of Americans panic over coronavirus and hoard toilet paper. We'll make America great again. Not so much.
How do you choose the point at which you decide, I'm too sick to work today?
That's the thing, is I've had to work when I was sick too, though. So obviously if I'm like deathly sick, I'm not going to work. But there's been times where I've had to work and I've had a fever and I've been coughing and I've coughed through the rides, and maybe the riders rate me low, but I need to make money, so that's more important than getting low ratings.
That very predicament is often a harsh reality for millions of hourly workers in America, where getting sick and not coming in for work means not getting paid. And as the number of coronavirus cases continue to grow, both globally and inside the United States, we are watching a slow-motion shutdown of our normal lives. An unprecedented number of public gatherings are shutting down, from Broadway shows to sporting events. Music festivals are being postponed or flat out canceled. And it's often the hourly workers who staff those events, the ticket takers, the maintenance people, the ushers, the cleaning crews. They're the ones who will feel the impact of those closures the most. And yet, while millions of Americans grapple with how to handle the pandemic and how it will change their livelihoods, their ability to pay the rent or the mortgage or even buy food, and Congress debates whether to provide free testing and unemployment money and how much to spend on that, the Federal Reserve pumped over $1 trillion into America's banking system this week. And just moments after declaring a national emergency and quite obviously name-checking our great corporations and business leaders, Donald Trump sent this autographed chart of stock market gains to his most loyal supporters. Joining me now, Ali Velshi, host of Velshi right here on MSNBC, and former Maryland Congresswoman Donna Edwards. Thank you both for being here. I'm going to come to you first, Ali. Donald Trump, with this weird presentation that he did, weirdly like an hour before markets closed.
Yeah.
It felt like the purpose of it was to try to fix the stock market crashing White House speech by boosting the markets by saying things that sounded rational.
Yeah, and it was great. It was the stagecraft was great, right? Having CEOs of the healthcare corporations, the pharmacies, that at least made some sense that, oh, I'm consulting with these people who know what they're doing, who can distribute testing, who can do that. But yeah, it was orchestrated for that because Donald Trump lives and dies by the stock market. I mean, signing a stock market sheet about the biggest increase, the day before we had the biggest decrease of 10%. The biggest point decrease in history. We've had a month in which you've lost 20% in the market. In the last year, you'd have lost 10%. So this is a tragic way to be going about this, but it did seem to be that the stock market loss and the danger of both stock losses and a potential recession spurred Donald Trump to take the public health part of things somewhat seriously. Even his delivery at the Rose Garden still seemed a little bit like he didn't really believe, he wasn't into it.
Yeah, I mean, I watch my Velshi show this morning, and a show you might want to check out from time to time. And I got the sense from the conversations that you were having this morning that we're already in a recession.
Ken Rogoff, who's an expert on recessions, has said so. Alan Blinder, former Fed chair, former Fed governor, has said we are in. Mohamed El-Erian, one of the smartest economists in the world, feels that we're already in a recession. Now, recessions come in different flavors, but Ken Rogoff this morning said this one could actually be deeper than the last one.
Yeah, and
that was a pretty bad one.
Absolutely, and Donna, I think that, and for most people, a recession doesn't mean the value of their 401ks goes down, because not even everybody has a 401k. Some people are lucky to. Some people work hourly. They're a waitress. They're my son is an usher. He doesn't have a 401k of being an usher.
He's got a job.
Right, he's working on and so you have people who are working hourly and people who don't have They don't have a parent they can move in with that are going to not be able to pay their rent. That is a recession to most people. People who don't have a backup and don't have $1,000 or $2,000 in the bank. What is that going to look like on the ground? And is anything being done from your point of view as a former Congresswoman to do anything about it?
Well, what you point out is, in fact, most people don't even have to meet an emergency need. And so one of the things that this coronavirus pandemic has helped us see is it's actually peeled back the onion of the low-wage economy, a service sector economy that's really dependent on those ushers and maintenance workers and daycare workers and wait staff at restaurants who depend on the number of hours in order to get their paycheck. And so while the president was doing whatever it is that he was doing yesterday in the Rose Garden, Nancy Pelosi and House Democrats were working with Steve Mnuchin to come up with a package that really puts those families, those low-wage workers, first in this downturn with the COVID-19. But it's not going to be enough to get through a recession. And I think one of the things that you see, and I was grateful to see this in the House-passed legislation, is that we seem to have learned from the financial crisis of 2008, 2009, that you can't just focus on the financial sector and the upper part of the income. You have to focus on low-wage workers, on workers who work for hourly wages, who depend on customers coming in and buying products in order for them to have a job. And so that's what this legislation does, very unlike the TARP, the Troubled Assets Relief Program that was done 10 years ago. And so that was helpful. But I think that we're going to need a lot more to get through whatever this next phase is. Look, we've been through a decade now of a strong and growing market. It was inevitable that we were going to have this cycle. We didn't quite imagine that it would happen like this, however.
Yeah, let me play, the bill sounds like it is a solid bill, but let me just first play for you Mitch McConnell's reaction to it, at least on Tuesday, because he's out of town now, so we don't know how he feels about it today. Here is Mitch McConnell on Tuesday.
Unfortunately, it appears at this hour that the Speaker and House Democrats instead chose to produce an ideological wish list that was not tailored closely to the circumstances. Instead of focusing on immediate relief to affected individuals, families, and businesses, the House Democrats chose to wander into various areas of policy that are barely related, if at all, to the issue before us.
First, this is to you first, Donna. What's in that bill that he thought was just unrelated to the various issues before us is free testing for COVID-19, increased paid emergency leave, strengthening unemployment insurance, boosting food security initiatives, increasing federal Medicaid funds. I guess that wasn't enough for the shale oil industry, the banks, and his donors, because he didn't seem to like it. Do you expect Mitch McConnell to nonetheless pass it, or put it on the floor at least, so that other people who maybe think more of the American people can pass it?
Well, I think what you saw in yesterday's vote, it was a strong bipartisan vote coming out of the House. It was a bill that was negotiated with the White House. It's been signed on to by the President of the United States at long last. And I think that there's not going to be any choice but to pass it in the Senate to get relief directly to the American people. And think about paid leave. Most people don't actually get paid leave.
Right.
And so they really need that in order to get through this downturn that we're focusing on.
Yeah.
And so this is not a wish list. I mean, it's a necessity for American workers.
Absolutely. Ali, 81.9 million people are paid hourly in this country that are age over 16. People don't have the luxury of staying home.
Right, and
they don't
remember,
have extra money.
The national minimum wage is still $7.25. A lot of states and cities don't have that. The push by most people is for $15 an hour minimum wage, which free marketers are completely against. They said, let the market set the wages.
Yeah.
$15 an hour gets you $31,000 a year pre-tax. Okay, we're not robbing the rich blind to pay somebody I invite a lot of people to try and live on $31,000 a year. That's what the issue is. So this weird ideological policy stuff that Mitch McConnell is talking about is what working Americans need. It's what people across the free world, the democratic world, get, by the way. We're one of the few countries that does not give people sufficient paid leave or maternal leave, right? We just don't do that. So that's not weird, but it is emergency stuff for the moment, and it should be done, because those people, if they get sick and can't go to work, like the guy that Jake Jake Ward was talking to, they're going to make other people sick. Then they're going to give us coronavirus, then we're going to give it to our elderly parents, and people will die. So this isn't just about whether you think the poor are being greedy at the moment. That's a discussion for another time. They will also get you sick, and this will be a pandemic. So let's do the right things to stem this. I think it'd be very hard for Mitch McConnell to not get behind this.
And he's up for re-election. I think the voters of Kentucky should really watch closely what this man does, because he hasn't exactly expressed a lot of concern for the ordinary man and woman in this country. There's a lot of concern for shale oil, rich people, making sure the affluent get tested. You know what? There are a lot more people in this country than the affluent. The rich need to get on board with the rest of us.
And they work. They keep our country going, as we'll learn in the next couple of weeks.
Good luck making this country work without ordinary people. Good luck working without ordinary people. Ali Velshi, Donna Edwards, thank you both very much. I'm a bit worked up this morning. I need to calm down. Next up, America. Thank you always, Ali. Thank you. America has overcome its share of challenges. Now, we will watch how that looks when a pandemic hits every single community in this country all at once.